right, so we have a question. That's a lymphoma question. A splenic marginal zone lymphoma patient in a 2-year clinical trial. I'm more worried about getting killed by C19, so COVID-19. I've had every shot and booster with very little uptake than I am about my lymphoma. Is there any hope on the 6-month horizon for better prevention and treatment therapeutics for the immune suppressed? We'll let Dr. Phillips take this one.
Yeah, I mean, the problem probably comes from if the trial includes rituximab, that is probably the reason why you're not responding to the booster. It is very good at preventing B cells from responding to any vaccination. So unfortunately, there's really no way around that. You can supplement things with IVIG, but really the thing is with these shots, the hope is that you would have is that you'll get some sort of T cell response from the vaccine. So that will hopefully supplement some of your deficiency in B cell response from the vaccinations. But depending on what drugs you're receiving, ideally, you would hope that once your treatment is over, that you should respond to vaccinations. We do have data that after a period of time, especially from you space out the time from a vaccination from a CD20 antibody, that you will respond as anybody else. There's really just getting some space away from your treatment into where your cancer. Since your cancer isn't curable, if you are that concerned, then maybe you just stop the treatment and go ahead and give your body a chance to recover, and then go ahead and get vaccinated. A lot of the stuff that's are in these trials are probably drugs that you can get off of the trial. If there's something that you're concerned that you cannot get off of the clinical trial, then at that point, then you probably just want to finish out your treatment course and then continue, like I said, just to get vaccinated and, mask up and reduce your exposure to others in the community, especially while we having peaks. But that's really the only thing we can do, unfortunately, because again, with all the mutations, a lot of the things we used before probably aren't working, other than maybe remdesivir and things like that if you do catch COVID-19.
Yeah, I agree. With time is the thing, and that's why with splenic marginal zone lymphoma and other indolent lymphomas, we used to, at least I personally in my practice, I used to give rituximab maintenance to most of my patients based off it prolongs the remission. But in the COVID era, I've largely changed that practice to give my patients breaks off rituximab because risk benefits have changed in our current era. And I will say, fortunately, as this current point, I can just speak on our hospital, and I take care of a lot of immunosuppressed patients, transplant patients. We are seeing less severe COVID than we were a few years ago based off infections and good vaccination, but it still is a concern. So I would say if you're doing well, minimize treatment if you can. And I don't know the specifics of the clinical trial.